You wake up tired, your grip feels weaker, you can't concentrate past lunch. Your temper is shorter than it used to be. And something that used to happen every morning doesn't anymore. If you just recognized 3 out of 5, your may already be declining, and your body has been sending you signals for months. We went through the clinical data to show you exactly what those signals mean. There's a myth that gets passed around so casually it's practically considered medical advice. You're over 40, of course. You're tired. That's just what happens. We've heard it. You've heard it. Your doctor may have said some version of it during a 10-minute annual physical, but that's not science. That's resignation. Here's what the data actually says. A study of over 2,000 men in U.S. primary care, published in the International Journal of Clinical Practice, found that 38.7% of men aged 45 and older had clinically low testosterone. Not a little low, clinically deficient. And the majority of them were never diagnosed. That's not normal aging. That's a medical condition hiding behind a cultural assumption. And the problem with buying into the "it's just age" story is that it stops you from noticing the real warning signs your body is sending right now. We identified 5 signals that show up consistently in the research on testosterone decline in men over 40. These aren't dramatic, they're subtle, and that's exactly why most guys miss them. Sign 1, your grip is getting weaker, not just in the gym. We're talking about carrying groceries, opening jars, each holding a suitcase. A study published in The Aging Male found a significant correlation between serum testosterone levels and hand grip strength across all age groups. Grip strength isn't just about muscles. It's one of the most reliable general health biomarkers in clinical medicine. If yours has noticeably declined, don't write it off. Sign 2, brain fog that won't lift. You sit down to read a report, write an email, or make a decision, and your focus just isn't there. It's not distraction. It's a different quality of mental processing. Testosterone affects cognitive function through androgen receptors in the cortex, and a review in the Journal of Clinical Endocrinology and Metabolism confirmed that low testosterone in older men is associated with reduced verbal memory and spatial performance. This isn't getting older. It's neurochemistry shifting under the surface. Sign 3, morning erections disappearing. Let's be direct. This matters more than most guys realize. Nocturnal penile. EPH equals tumescence greater than tumescence, or NPT, is your body's built-in diagnostic test. It happens during REM sleep and reflects health, blood flow quality, and hormonal status. A study in the Journal of Urology confirmed the relationship between sleep-related erections and testosterone levels. When morning erections become inconsistent or disappear, it's not just a bedroom issue. It's a signal that your neurological, your system, possibly all 3, needs attention. Sign 4, your mood is less stable. Irritability, short fuse, a general sense of being off. Men tend to write this off as stress, and sometimes it is. But testosterone plays a direct role in mood regulation through its effects on and GABA pathways. Research in the archives of general psychiatry has linked low testosterone with increased rates of depressive symptoms in men over 45. If your partner or close friends have noticed a change in your temperament, that's data. Pay attention to it. Sign 5, recovery takes forever. A weekend of yard work, a moderately intense workout, even a bad night of sleep. If your body used to bounce back in a day and now it takes 3, that's not because you're out of shape. Testosterone is a primary driver of muscle protein synthesis and tissue repair. When levels drop, recovery slows measurably. A meta-analysis in PubMed confirmed that testosterone directly influences exercise recovery and adaptation in men. Here's the pattern. None of these 5 signs will send you to the ER. That's the problem. They're easy to explain away, one by one, But when 3 or more show up together, the research points in one direction. So what do you actually do about it? We're going to give you 2 steps, one you can do tonight, one you should schedule this week. Step 1, the 1-hour sleep shift. This is the single highest leverage change you can make without spending $1. A landmark JAMA study found that restricting healthy young men to 5 hours of sleep per night for just 1 week decreased daytime testosterone levels by 10 to 15%. The lead researcher, Dr. Eve Van Cotter at the University of Chicago, described that as equivalent to 10 to 15 years of aging, hormonally. Here's what we know about the mechanism. Testosterone production is sleep-dependent, not just circadian. A review in the Asian Journal of Andrology established that testosterone begins rising after sleep onset, requires at least 3 hours of uninterrupted sleep with normal architecture, and peaks during early morning sleep stages. Fragmenting that window with screens, light, noise, or going to bed too late directly suppresses production. Tonight, shift your bedtime 1 hour earlier than usual. Set a hard cutoff on screens 30 minutes before. Drop your room temperature to somewhere between 60 and 67 degrees Fahrenheit. Multiple studies, including a 2026 review in BMC Medicine, confirm this range supports deeper, more restorative sleep. This isn't a wellness tip, it's hormone management. Give it 2 to 3 weeks consistently, and you should notice a difference in morning energy and alertness. Step 2, get the blood work. Not a basic panel. Ask your doctor specifically for total testosterone. Free testosterone, SHBG, and morning draw before 10 a.m. Use fasted. These 5 markers together give you a real picture. Total testosterone alone can be misleading because SHBG binds testosterone and makes it unavailable. If your doctor pushes back on ordering these, find one who won't. This is standard diagnostic workup for suspected. It's not exotic medicine. It's one important note on breathing. Breathing slow. Deep belly breathing for 2 to 5 minutes before bed has genuine evidence behind it. A 2017 study in Frontiers in Psychology found it reduced cortisol levels and improved attention. It's not a cure, but as a pre-sleep wind down, it outperforms scrolling your phone. Just don't expect it to fix a structural stress problem in your life. Here's what we want you to take from this. If you recognized 3 or more of those 5 signs, you're not falling apart, but you're also not imagining things. Your body is doing exactly what the research predicts it would do when testosterone declines without intervention. The good news is this: you caught it. Most guys don't, because nobody tells them what to look for. Now you know. Tonight, shift your sleep. This week, get the labs. That's it. 2 moves. You don't need to overhaul your entire life. You need data and 1 better habit. If this was useful, subscribe to Still Got It. We cover men's health backed by actual research. No supplement sponsors, no scare tactics. Hit the like, it pushes this to other guys who need to hear it. And leave a comment. Which of the 5 signs hit closest to home? We read every one, and it directly shapes what we cover next. Quick note, we're a research team, not medical providers. This content is educational and does not replace professional advice. Always consult your doctor before making health changes. Every study cited is linked in the description below. Next week, the foods that are quietly tanking your testosterone while you think you're eating healthy. Some of them are going to surprise you. Make sure you're subscribed so you don't miss it.